Welcome to DNA, and today on our podcast, we are joined by Mr. Abhilash K. Ramesh. He is the Executive Director of Kairali Ayurvedic Group, and who is better than him to talk about Ayurveda? He has played a key role in positioning Kairali Ayurvedic Group and the Ayurvedic Healing Village among the top 10 global destinations. Welcome, sir.
Thank you so much for having me here.
What is Ayurveda? Where did it come from?
So, Ayurveda is an Indian science. It's a 5,000-year-old science. It's quite popular now in India and throughout the world post-COVID. And in Kairali, we've been following this traditional Ayurvedic sciences.
I want to just understand, we talk about health and wellness, but as per Ayurveda, who is a healthy person? Like, who is healthy? What do you call a healthy person like?
So who is healthy is someone who does everything in moderation, in balance.
Okay.
Right? There are so many, everyone's an individual. Everyone has their own imbalances or balances or body types or constitution. So anyone who follows what their body tells them to do is healthy. There's no certain set standard that you have to be a certain size or certain weight. Everyone has their own thing. So if you're Pitta dominant or Kapha dominant or Vata dominant, it all depends. And as per age also, as per gender as well. So your body progresses with time. You can't always be the same how you were when you were in your 20s, when you're 50s.
So just as you were mentioning about doshas, like, what are the 5 elements and doshas? How crucial are these to understand before we start with a treatment?
It is very important, right? The doctors do these nadi pariksha. They want to understand what kind of, what is the imbalances that are affecting your body or your mental imbalances, right? So they will do the nadi pariksha. They will understand what kind of dosha is imbalanced in your body type. As per that, they will prescribe either a medication or a treatment protocol as per that.
How to understand that now I have to go for Ayurveda, when to go for allopathic? Like, where Ayurveda comes in?
So, if it's an emergency situation, if it's there is no cure for everything in Ayurveda, right? So there are certain disorders or diseases that we will recommend that you go for a treatment in the allopathy line. And Ayurveda is, if you want a more curative experience where the symptoms are treated, not the symptoms, just the root cause are treated, so then you come to Ayurveda, right? If you have, and there are proven case studies as well, clinical researches as well, where you can do treatments for liver cirrhosis, so type 2 diabetes can be reversed to a certain extent, right? Weight management can be done. So for certain disorders, we highly recommend Ayurveda. I would not recommend allopathy, but if it's an emergency, definitely go to allopathy.
Post-COVID, things have actually changed. People have taken responsibility of taking care of their health. And some have actually moved towards Ayurveda. So have you seen that shift?
So, see, Ayurveda is not just a massage or a medicine. It's a holistic lifestyle. So the adoption has not just been, okay, I'm sick, I will go for treatment. No.
Yes.
The adoption also has been, I'm healthy, I want to stay healthy, so it's preventive as well. So being in the types of food they eat, as per their body, being what they drink, moderation in alcohol, or cutting it down completely, so a lot of things. So the lifestyle regime has changed. When people started appreciating how life can be so uncertain,
Absolutely.
they started taking care of themselves. So, and Ayurveda teaches them how to take care of themselves.
There's a lot of discussion happening around diet. People are changing their diets every day. But when we talk about Ayurvedic specific diet, what is it?
So during the treatment protocols, that time we have very specific diet standards. You have to, it has to be easily digestible, easily consumed. So especially during panchakarma and all. But if in a day-to-day healthy person's diet, eat as per your body type. Eat a very balanced meal.
Okay.
Make sure you have your fibers. Make sure you have your leafy vegetables. Make sure you don't have an overly saturated oily food. Have a balance of carbs and all. So go to an Ayurvedic doctor, and they can definitely prescribe you a diet for your healthy lifestyle if there's some imbalance in it, right? So they can at least guide you in what is your body type and what you should avoid and what you should eat.
Since we were talking about diet, every herb has its own potent medical healing properties. Is it so? Medicinal healing properties.
I can't say for all herbs,
Not
yes,
all
but there are medicinal plants that all have multiple use cases in Ayurvedic medicines, and they have multiple properties, and in different types also, or forms they can be used. And different parts of a plant also can be used, from roots, stems, and leaves, right? So each has its own benefits and can treat a certain disorder depending on the form they used in and how they are processed.
Okay.
Right? So, yeah. So, it depends on the disorder or the medication they're trying to make. I wouldn't say all herbs, but yes.
Certain herbs.
Certain, yes.
But in this current age where we have advancement and all kinds of medical treatment and practices, how Ayurveda tries to say, relevant?
See, it's a 5,000-year-old proven science. It's not about staying relevant. It's a lot of people already practice it. I think a lot of people forget it's a recognized medical science in India. There are BAMS doctors. There are doctors who actually go and study this and then practice it. So it is an accepted science in India. Being relevant, I guess, is it a trend-based thing? It's not a trend-based thing. It shouldn't be a trend-based thing. It's a medical science, right?
Mental health also plays a crucial role. Talking about, again, connecting it with Ayurveda, how do you see it? I mean, having a healthy mind is very important when we start with any kind of a treatment.
So it's an integrative approach, right? We use yoga as well as we use psychology from modern medicine as well. So we use all facets to help what suits the client's need or the patient's need, right? So we're using certain types of pranayama, meditation practices, yoga practices that are specifically tailored for them. And then you need someone who can also listen to them, someone who's open and listening to them. So we use psychologists as well, or psychiatrists as well, but not the medication. Just for them to sit and have somewhere where they can express their concerns and desires, and we can help them heal emotionally as well. Yeah.
So in today's time, people don't have time to do anything extra for themselves. How do you think that they can incorporate Ayurveda in their day-to-day life?
So first,
even these practices.
First, I think, see, that's a very, I wouldn't say wrong, but a different mindset. We come from a very different mindset. We look at investing in ourselves, right? So if you don't invest in yourself today, even for 5 minutes, you're probably going to lose a lot more in the future. So when we look at it from that,
you're talking about inner balance first.
In a balance, be it being healthy, being walking, eating healthy, right? Sometimes what we do, we take the short way out. Let's go eat McDonald's. It's 5 minutes, it's easy. But saying no to that and trying to go eat something healthier will compound and help you in the future, right? So what we say, just eat healthy. Be conscious of what you're eating. Have a little movement do a little yoga in the morning. So those are the things.
So if I have to ask you about, there are so many brands available outside.
Yeah.
There's so many products available. How can we try to understand which product, which brand is authentic, and how do you see this industry moving?
We work very closely with the regulatory bodies as well, with our other industry partners as well. First is read the label, right? If you read the label, you'll kind of understand where it's manufactured, or who's manufacturing it. Is it really Ayurvedic? Under what license it comes? So there are multiple licenses, licensing bodies in India. So is it a food license or is it a medicinal license, medical license, right? That itself will let you know what kind of product it is, right? And self-prescribing and self-medicating is never recommended. Go to someone who's an expert, go to a doctor, take that 5 minutes out. They'll recommend products that really suit you or you really need, instead of just popping something off the shelf, going for the marketing or the flashy designs. Yeah.
And what would be those 3-4 habits or practices that you would, Ayurvedic practices, that you would like to suggest to the audience?
Drink warm water. It really helps. Infused warm water with a jeera or something. That instead of cold, it reduces your metabolic activity. Eat fresh, eat healthy, eat warm food, right? Not packaged, not over processed. Like at the Healing Village, we don't use anything that comes in plastic package. We try to source everything organically, locally, seasonally, fresh. Now that might not be possible where you live or financially viable always, but from a local sabji wala, if you get whatever fresh fruits and sabjis, if you use that and cook it, perfect. That itself will help you a lot, because food is medicine. Then like I said, do some yoga, be active, right? Walk, at least if you can't do yoga, right? But if you invest that time now, even if it's 15 minutes a day, it's more than enough. Yeah.
But are there any common myths that you would want people to just let go of, like when we talk of Ayurveda?
Common myths is, okay, I have a pet peeve. People pop ashwagandha and neem and these tablets as if it's candy, without understanding the pros and cons and the benefits. Do you actually need it? Is it suitable for someone like you? Right? What was I? I was just seeing something. It's relevant. Almond milk. Right? Is it good for you? Do you need it? Okay, if you're vegan, maybe it's an alternate source, but excessive of anything in your body, even almond milk, is very bad. Right?
Is it?
Yeah. So you shouldn't.
Excess of everything.
Excess of everything. Yeah. If you're replacing something, don't overdo it. Right? Yeah.
But there is this common thing that, ashwagandha is good for this thing, let's just take it. There's no harm of taking it. And then there's something good for kidney, something good for liver. Just take it.
Yes, but they
without even thinking much about it.
Yeah, mixing a lot of things, and it could compound. Ashwagandha could be a byproduct in other pills or tablets as well.
So there is this extra intake.
It's extra intake, and then it's not everyone's body is suited for it. It's not something you always need, right? So self-medication, that's something I would highly recommend. Don't do it.
Long back, people never used to store food. We used to just eat freshly cooked food. Now today, people are storing food, considering the couple has to go out, work, they cook in the morning, they have the same food during the lunchtime. Is it healthy? Is it right?
So that's a very good point. That's a very valid point. So there are a lot of restrictions considering our time and how busy our lifestyles are. We're nuclear families, not like we were back in the day in joint families. But short answer, no, it's not. Try not to have extremely processed food, over-processed food. Having fresh food, by far, living like we lived before we started getting everything in little mini packets or app that we could just order everything at our convenience and overeat and overindulge is wrong. We should have fresh, warm food as for all 3 meals. Is the right way to do it, and it's the Ayurvedic way to do it. Right?
Do you think Ayurveda can play a larger role in our public health system?
It has, and it has been supported also. We've now been covered. Ayush has its own ministry. They have an insurance empanelment has happened. A lot of people are availing it as well. It's in its growing infancy stage. There are some issues still.
It's not yet mainstream.
It's not mainstream. We are trying to make it mainstream and help getting it covered with the masses as well. But there has been a significant amount of growth. If you see from state-wise, like if you see a state like Rajasthan or UP, there's huge adoption in Ayurveda in the mainstream, in the masses as well. It's cheaper as well, or 14 days, yeah.
Okay. Do you think that the wellness industry is actually grown? Like, where do you see it heading? And how has it been so far? Like if I have to compare it with last 10 years, how do you see the next 10 years like?
So now the wellness industry or the Ayurveda industry is quite large, and a lot of things get merged into it. So this one is the medicinal side, we would say. Then there's the generic product, OTC counter products that we would say. Then there's the services, clinics and hospitals. Then there's the training and universities, etc. So there are three very segregated industries, but they all get clubbed into one, right? If you see now, let's say one vertical, the product vertical, like you said, there are so many new brands coming because there's a demand. There's a huge demand, and especially post-COVID, the growth has been substantial, I would say, a year on a year, 20 to 25% growth. That's we've seen just in the product division. On the services as well, since a lot of people have started accepting Ayurveda, they come for their treatments as well. That's also seen a significant growth.
So Kairali Ayurvedic Group comes in a very premium category.
Okay.
Do you plan to make it more accessible to other people, or what's your idea?
I would not say it's very premium, but yes, it comes in above average. The Ayurvedic clinics that we have across India are priced moderately. But yes, if you go to a hospital or a retreat, if you go to an allopathy hospital also, it is expensive, right? Because the doctors' salaries are very high these days. The nurses also are very high these days. Maintaining something, or like in Kerala, it's a 65-acre asset where it's self-sustained, growing our own vegetables and food, and having nearly 200 odd staff. It's a very expensive thing. We couldn't charge at a lower price point to make it sustainable or viable. Maybe if we can see, we can create something smaller, but we as a company have decided that this is the price point the hospital will be at, but the clinics are at a more affordable price point. It starts at about 1,500 rupees a treatment. And if you do a course of over 13 days, it's cheaper as well, or 14 days in the future.
What are Kairali's upcoming plans?
So we also are multifaceted or multi-vertical company. So we have our clinics, which we plan to open. Our target, and hopefully it comes true, is to open one every month.
One every month?
A clinic every month. So we to reach about 120 odd clinics across India. We are about 40 odd clinics now. And so that's our next 3-year horizon that we're looking at. And then with our, what we call our hospital and hospitality sector, we have one retreat in Kerala. We're just opening our new one in Goa, hospital in Goa. It's more yoga and Ayurveda focused. We have one in Europe already. Now we're looking at expanding internationally in another country, and one more in India.
Well, on that note, sir, thank you so much for joining us today, and thank you for sharing all the details.
Thank you so much for helping us propagate Ayurveda and Kairali to the world. Thank you so much.